is exciting because you're going to be able to be with hundreds of leaders across Ontario that have the same kind of issues that you have each and every day on the front lines. Be prepared that the Drummond's recommendations specifically on labor relations, if they were implemented, as Dan has just explained to you what Drummond's thinking, we are in significant trouble as unions representing nurses, because this is basically eradicating a number of strengths as far as being a unionized worker.
The leadership role that you've played in protecting and defending public Medicare in this province and across the country, really, we could not do it without you.
I'm very happy to say that I can stand here today and say I'm a member of ONA and I am proud to be in a union. Thank you.
As an organization, ONA has been incredible to us as students. Our members are always thrilled when ONA board members and staff are present at our events. Many of our leaders are already looking into ways to get involved in ONA after their graduation this year.
I really believe that no matter what employers say, there's no possible way that a school could prepare a new nurse to work in every single possible place that new nurse could find themselves once they graduate. It just can't happen. There's just too much technology. And there's too much specialization that goes on. And so the Nursing Graduate Guarantee, it really is about patient safety and helping the nurses to get integrated into the workforce. And so this is something that the government's really committed to, and I think that's an amazing thing.
prepared to be here for the long haul, absolutely, whatever it takes.
Nobody actually wants to be in the hospital, but if they have to be, they're being cared for by extraordinary men and women. Our nurses in Ontario, I always say Ontario's nurses are the best nurses in the world.
Each and every one of you, no matter what unit you work in, need to stick together. You need to be unified. You need to be unified in your voice at your unit level. You need to advocate for your patients, and you need to advocate for each other in each of your units.
The austerity budget is a budget that projects major cost curtailment in healthcare, amounting to about $4 billion in cuts, mainly to hospitals and OHIP, but also curtailment in long-term care and home care for the next 5 years at least.
So when people say that Canada's fiscal problems, Canada's fiscal deficits are the result of an expenditure problem, they are lying to you. Our fiscal problems, to the extent that we have them, are a consequence of the tax cuts that have been implemented at the provincial level and at the federal level in Canada over the last 10 years. Tax cuts which it turned out that we could not afford.
This is 2012. This is Ontario. We deserve decent health care and decent health care in our communities. And we have to stand up for it, and we have to fight for it, or we will lose it.